Thank you very much. I'm here to talk to you about ceramic-on-ceramic bearings in total hip arthroplasty. So ceramics have evolved over the decades from the Mittelmeyer implants on the left to the Biolox Delta material, the pink material on the right. In Australia it's dropping, it's lower than this, lower than 26%, but there are some countries that have higher and some countries have lower use of ceramic-on-ceramic, but overall it's dropping and not as high as polyethylene. Ceramic-on-ceramic bearings have low revision. This is the revision by bearing, and you can see ceramic-on-ceramic down the bottom there in the mix with the cross-linked polyethylenes, but no superiority shown of ceramic-on-ceramic over cross-linked polyethylene in revision by bearing surfaces. We previously published the midterm results of third generation Illumina ceramic-on-ceramic, and we're currently collecting the 20-year results on this cohort of patients. In these 300 patients, we had 3 patients with a benign squeaking that were not revised for that noise. And so we've, over the years, done a lot of ceramic-on-ceramic bearings and collected the retrievals, and I'm going to show you the results of an analysis of these retrieved ceramic bearings. This is the demographics of the retrieved patients. They were retrieved for squeaking, for sepsis, aseptic loosening, etc. None of them, very few of them for bearing failure. So what about the wear in Illumina ceramic-on-ceramic bearings when we look at retrievals for edge loading? This is the typical patient, a 47-year-old female. She was revised after 33 months for irritation of the psoas tendon, so not related to the bearing, and she had this pattern of edge loading wear. So paradoxically, ceramic bearings don't wear concentrically, they only wear significantly when the head rides up on the edge, and you can see the wear on the edge of the cup and the wear on the head. And when we measure the depth of this wear, it's very small and very difficult to measure because it's such a small amount of wear. We get these different patterns of stripes. So the concentric wear is not measurable. The edge loading wear occurs in actually the majority of our retrievals. In 84% of our retrievals we see some evidence of edge loading. And the median wear was only 0.2 millimetres cubed per year, which is very, very small. The angle of that stripe, whether it's negative or positive in a left hip, can tell you whether the edge loading was posterior edge loading or anterior edge loading. So in a left hip, a downward sloping stripe is anterosuperior edge loading at the end of stance phase, and the opposite for posterior edge loading. The anterosuperior edge loading, which is during walking, produces a higher wear volume. The posterior edge loading produces low volumes of wear, and this is because that's when the patient's standing from a chair, so the activity is less frequent. We can measure the width of that edge loading wear stripe and correlate that with the volume of wear if you don't have the machine to measure the volume. And when we looked at the alignment of the components and compared that to the wear of the bearings, we came up with a safe zone here for low wear, and the black bearings, the black boxes have low wear, and so if you have a combination of high antiversion, high inclination, you'll get anterosuperior edge loading, low inclination, low antiversion, you get posterior edge loading. When we compare them to our retrieved metal-on-metal bearings, and so I'm going to show you a comparison of 2 different types of materials. The metal-on-metal bearings have this very dramatic reaction of the soft tissues and the bone to the wear debris with pseudotumours and necrosis. And metal bearings have edge loading, and they also have concentric wear, whereas ceramics only have edge loading, no concentric wear. And so the difference between ceramics and metals is that metals have higher volumes of wear than ceramics, and the wear debris in metal causes wear debris related failures. In ceramics we almost never see wear debris related failures, and we used to see osteolysis with polyethylene. This is the old polyethylene in our own data showing that ceramic-on-ceramic osteolysis is virtually eliminated. And the histology of the wear debris on ceramic bearings is very mild. There's mild synovitis. So with ceramics you get a little bit of synovitis with polymorphs. In polyethylene you get macrophages and synovitis, and in metal you get pseudotumours, granuloma and necrosis with lymphocytes. We do see, if you have impingement with a ceramic-on-ceramic bearing, you can have titanium debris. This is titanium debris in the tissue of a hip with impingement. So paradoxically, with ceramic bearings, The dominant wear debris, if there is a problem, is actually the titanium stem. And that was the work of Christina Esposito, who spent some time at Hospital for Special Surgery. What about squeaking? Everybody's concerned about squeaking with ceramics. This is a meta-analysis that I published a couple of years ago showing the incidence was between 0 and 5%. It's higher with the Accolade stem, but the revision for dislocation is actually very, very low. It's quite rare, 0.03% revised for squeaking on the Australian Registry. And that's because squeaking, even though it occurs, is usually not problematic for the patient. It occurs infrequently, and it occurs with bending activities, not with walking, more commonly than walking. The squeaking is related to the natural frequencies of the components, and we think it's the femoral component. So this femoral component on the right, the Accolade, is 3 times less stiff than the secure fit on the left and has a higher rate of squeaking. We've used larger diameter monoblock ceramics with good success, and just recently we've started using this ceramic on ceramic resurfacing. There've only been a handful of cases done worldwide, but this is perhaps the next thing, a ceramic on ceramic resurfacing to get the advantages of the ceramic and the advantages of the resurfacing without the problems of the metal debris. But that's a new thing, so we'll have to wait and see if it really will work. So thank you for your attention.